here, there have been huge changes in the guideline for potassium for people with kidney issues. Everything you and your doctor know about potassium is now wrong. Avoiding potassium-rich foods was once written in stone for those with CKD. Today, dietary potassium intake should not be limited anymore, says new guideline. Patients should now be recommended to eat potatoes and bananas, and, well, I think you should be informed about this. So today we talk about potassium in the diet. Because changes this big in the clinical guideline don't happen very often. Don't underestimate this. Everything a doctor does, any medication they prescribe, any dose, any therapy, they do it because there are guidelines telling them to do that. And now, the guideline for nutrition in kidney disease change. Now guys, this is some of the biggest news that ever happened in the world of CKD. So I want you to be proactive about potassium now, but don't change your diets without getting informed and without consulting your doctor first. I want you to print or to save on your phone the studies I'm gonna show you today. Links are in description, by the way, and I want you to show them to your doctors because every single kidney disease patient knows that they must avoid potassium-rich foods. But did you know that having too low potassium is just as common for kidney disease patients as having too much of it and just as dangerous? Guidelines are changed and telling every single patient that they need to limit potassium should be a thing of the past now. But unfortunately, some doctors are not informed. Some doctors neglected their refresher courses just like they neglect their patients. They will still tell you that if you have renal problems, you must avoid potatoes, bananas, tomatoes, oranges, avocados, and exotic fruits. In this video, I will show you 7 reasons why eating more potassium-rich foods may actually help your kidneys. Let's see them. Number 7, potassium-rich foods are actually good for you. In a study conducted on CKD patients in stage 3 and 4, test subjects who were instructed to eat more fruit and vegetables were able to witness a miracle. So, their kidney disease progression stopped. Some patients even had an improvement in kidney function. All that thanks to a diet that was richer in fruit and vegetables. Now, what I want to point out is that these patients were also told to disregard most cautions regarding potassium-rich foods. They were instructed to eat potatoes daily. They were told to eat vegetables with abundance, including those rich in potassium like kale, broccoli, and Brussels sprouts. This was, of course, only true for those patients without already high serum potassium levels. After that, however, a different study was even able to prove a link between an increase of dietary potassium and better kidney outcomes and longer survival. So yeah, that's a good first reason why potassium is actually good for you, because science says so. But there is more. Reason number 6, your potassium allowance is probably bigger than you think. Every single kidney disease patient knows that they must avoid potassium-rich foods. But do you know that if your serum potassium level is not too high already, eating a banana or 2 won't change a thing? Current guidelines state that every single kidney disease patient should be individualized when it comes to potassium allowance. And this huge update to kidney disease guidelines was published back in 2020. Has your doctor talked about this with you yet? Please let me know if that happened in comment section, because I really believe that very few patients have been instructed about the change this important. So what you need to know is that your serum potassium levels should be between 3.5 and 5.5 milliequivalents per liter. This is something you can check on your blood test. Are you in the right range? Because if you are, you probably want to eat way more potassium-rich food than what you currently are. And if you aren't, you probably still want to eat way more potassium-rich foods. More about this later. So the big question is, how much potassium should you intake daily? Well, a lot more than previously recommended. This brings us to the next reason why potassium is actually good for your kidneys. Reason number 5, your body absorbs way less potassium from plant foods than it was believed. You see, it was commonly believed that the human body was able to use up to 95% potassium from fruits and vegetables. So they used to say that if you eat a banana, you will get around 400 milligrams of potassium. And with a potassium allowance ranging between 1600 milligrams and 4000 milligrams a day for most patients, eating bananas was considered bananas.
Every room in the house, that is bananas.
Yeah, well, they were wrong about that. Because when the hypothesis that we absorb almost all potassium from fruits and veggies was put to the test, it was found to be wrong, as we can read here. When researchers examined the impact of the DASH diet on 11 patients, increasing potassium by 3000 milligrams in the diet only increased the urinary potassium excretion by 780 milligrams, meaning 2200 milligrams of potassium were unaccounted for. So what this study proves is that if you eat a banana, you are probably going to get less than 200 milligrams of potassium. Should you be concerned about that? Probably not. This brings us to the next reason why you should eat more potassium-rich foods. Number 4, patients who eat more fruit and vegetables have lower blood pressure. Now, it's worth noticing that in the study I mentioned previously, they also found out that potassium from additives is way more bioavailable than potassium from fruits and veggies. And while potassium intake from any source is supposed, in theory, to lower your blood pressure, only a diet rich in fruits and veggies can give you this benefit also in practice. So eat more bananas, eat more spinach, and eat avocados too. As we will see in a moment, these foods are probably gonna help you lower your potassium levels. And what if you are too high in serum potassium levels? Well, even in that case, limiting potassium intake from food is not the right strategy, say current guidelines. This brings us to the next reason why potassium is good for you. Number 3, high potassium levels are mostly caused by factors not related to the diet. Okay guys, as we have seen, 1 out of 5 patients do actually have too high potassium levels. And while it's too easy from a doctor's perspective to point the finger and exclaim, "How many bananas have you eaten?" that's not going to help the patient at all. Because you see, I eat potassium-rich foods every day, and I even supplement potassium when I go to the gym, which is basically every day, and yet my levels are always in range. So why do certain patients have too high potassium levels if it's not the foods? Here's the answer directly from current guidelines for CKD management. Clinicians should actively investigate other factors that contribute to hyperkalemia before reducing dietary potassium intake. These factors include constipation, inadequate insulin, untreated metabolic acidosis, inadequate dialysis, and medications. So to be clear, this says that if you have too high potassium levels, your doctor should check if you are constipated, if you are taking enough insulin if diabetic, if you are doing dialysis often enough, if in dialysis, if you have metabolic acidosis, and if you are taking certain medications. If all these are in check, then and only then your doctor should limit your potassium intake. And this is a huge step forward from what doctors were doing until today, which was limiting potassium intake and giving a huge list of healthy foods to avoid to their patients. But trust me when I say that very few patients without any of these issues are going to have too high potassium levels. Let's see why. Reason why you need more bananas. Number 2, metabolic acidosis. You see, one of the most common reasons why potassium is too high in those with CKD is metabolic acidosis, as we can see here. What is metabolic acidosis? Metabolic acidosis is the buildup of acid in the body due to kidney disease. It's a serious condition which is also unfortunately common in patients in the advanced stages. It can cause kidney damage and also nausea, vomiting, fast breathing, and lethargy. It's also one of the most common causes of high potassium levels. Now, what you must know about metabolic acidosis is that eating alkaline foods can help treat this condition. But what foods are most alkaline? Those richer in potassium. You see, dietary potassium is highly alkaline in nature, making it beneficial for neutralizing excess acid. This is why, in many cases, eating more potassium-rich foods can actually help lowering blood potassium levels. Now, if you want to learn more about what foods can really help, watch my video up here. But there's one more reason why potassium in the diet is good for the kidneys. Number 1. Hyperkalemia is mostly caused by medications. This is a well-known medical fact. I talked about this way before the new guideline was released. In kidney patients, the most common cause of high potassium levels are certain medications used to treat high blood pressure. And you know what can reduce your need for blood pressure medications? A plant-based diet with foods rich in potassium. Now guys, if you want to know more about what medications are known to cause this issue, watch my video up here, and this is all for today. Thank you for watching. God bless.